It's absolutely inspiring to have the two head honchos from diabetes.co.uk. It's Charlotte Summers and Arjun Panesar.
Thank you.
Oh, amazing. Thank you very much, Sam. What a weekend we have had. So yes, my name is Charlotte Summers, and this is Arjun Panesar, and together we run and manage Diabetes Digital Media. And we absolutely love the PHC, not only because of Sam, but also because it's a huge opportunity for us to reflect on the year. And I think we've been supporting Sam and the organisation for the last 4 years. And it's really great to reflect on where we are with the movement towards real food, but then also for us as an organisation. I think 4 years ago we started with the PHC, and Arj did a presentation that actually I think you may have been wearing this same shirt.
I was.
So we started, and we were sharing the insights that we generated from the first 100,000 patients who had gone through the low-carb program. And 4 years on, I think it's amazing that we are now scaling type 2 diabetes remission on a global scale. We're working with reinsurance, insurance organizations, healthcare systems, really redefining the paradigms that we're currently working within, especially when it comes to type 2 diabetes. And the opportunities that we see in front of us are just vast, especially when we're seeing the expansion of the program beyond just diabetes and metabolic syndrome into some of the other conditions as well.
So currently, diabetes is $1 trillion problem, and as we all know, it's costly and unsustainable. That starts at diagnosis, and so this is really where the beginning of the data geek in me starts to show. When you are diagnosed with type 2 diabetes, typically you're overweight and you present your symptoms at that point in time. The reason I mention that is because with the advent of the mobile phone, with things like Freestyle Libre and cloud-based systems, we're able to deliver data to the cloud, and we're able to do a lot of crunching on that. So just wanted to make a note about the fact that you don't have all of these swatches of data. You only have what you present yourselves with. You then put on typically a medication-first approach. And what we do know is there's a lack of education. I can certainly vouch for that, not only in the patient community, but also the healthcare professional community. And typically you put on an approach that is perhaps why type 2 diabetes was considered to be chronic and progressive. And this is really, a costly and unsustainable approach. Now, when you are placed on standard care, what we do know is that when you are diagnosed with diabetes, 2 in 3 people aren't quite sure what affects their blood glucose levels. And that makes perfect sense. I think Ian hit on some of the factors that can affect blood glucose levels, but there are so many that that's really why people move to communities like ours in order to find information. What we do know is that patients spend less than 3 hours a year with their healthcare professional, and as a result, they then turn to the internet and other community and peer groups in order to understand how to best manage their condition. And that's really where we come in. So we look at augmenting traditional healthcare, and we do that with a behavior change first approach. So this is all about sustainable behavior change and really Charlotte's forte. But from my perspective, we are presenting patients with evidence-based, scalable digital health technologies. And to you and I, that essentially means a mobile phone app or a platform on your Amazon Alexa or in virtual reality that you can engage with. And once you're put on a behavior change platform, or once you are engaging in behavior change, whether it's digital or not, we begin to augment care. And what's fascinating for me as an engineer and as an IT specialist is we're able to achieve something that medication can't. So you can put a type 2 diabetes patient on medication, but they will never actually achieve type 2 diabetes remission. Whereas if you give them behavior change, regardless of whether it's supported with a digital platform or if it's actually in the community, what we're able to achieve is remission, and that provides such hope for patients and clinicians in particular. And then this is where the geek in me turns into ultra drive, because what we're able to do is if we can give people with diabetes, people with type 2 diabetes, pre-diabetes, whatever the condition, the ability to accrue data, we're then able to predict and diagnose risk of future conditions with such predictive confidence that we really can begin to perhaps predict the likelihood of future illnesses or perhaps the reduction of those illnesses as well. And as we all know, the National Diabetes Audit found that less than 1 in 10 patients attend structured education. And even if they do, 6 in 10 don't meet their treatment targets, which are arguably considered to be quite lax.
And realistically, that's where we come in. So we have developed the low-carb program as a structured behavior change platform. So we engage with patients not only with type 2 diabetes, pre-diabetes, and those that are metabolically unwell. We've really encapsulated the education that they need, combining that with the behavior change elements to support not only the management of these conditions, but ultimately with the goal of remission. So we've been working with Dr. David Unwin, and we used the feedback and the data from over 20,000 patients with type 2 diabetes to really develop this intervention, being data-led and understanding what they really require to be able to make some significant lifestyle changes. The program starts with a 12-week implementation phase, and it's then supported with a lifetime of maintenance and engagement. We know that when we're making changes, whether that be to your nutrition or other modifiable risks such as sleep and stress, it's not something that you can necessarily do on your own, and we really need to support that with both resources and the elements that we have within the platform. We're pleased to have published in a peer-reviewed journal and been working with some amazing experts from around the world. And we've localized the platform for the UK and also Ireland. What's most important, though, as a structured education platform, we have been working with Kismet, so it can be prescribed as structured education, but also it can be regarded and classed as a medical device. So we work with the MHRA, and we're also, as of the beginning of this year, backed and supported by NHS Digital. The platform is available on iOS, Android, on the web, and also we're integrating with different technologies such as the Amazon Alexa. I really don't think I need to tell everyone in the room just how much of a complete global overhaul we have seen in the dietary guidelines in the last couple of years, and in particular, probably the last month. I've been absolutely privileged to be working with Dr. Laura Saslow, one of the lead authors in the ADA consensus report. And I think, especially when it comes to the work that we've been doing on the low-carb program, there's a couple of things that really stood out to us. First of all, that reducing overall carbohydrate intake was the most evidence-based attempt at putting type 2 diabetes into remission and improving overall glycemic control. But what was also important for us as a platform with the capacity to hyper-personalize education and information was the fact that the ADA actually said that the low-carb approach was able to be adapted to most dietary interventions. And for us, that's so important because we know that different people engage within the platform from different ethnicities, different age groups, different technical capabilities. And by being able to adapt the education around the dietary approach, that's what I think is really important for us. So just going through the platform in a little bit more detail, we have structured education that has been developed and been led by some of the world's leading experts. And until we're able to clone the likes of Dr. Unwin and give them to all of these patients around the world, what we're doing with not only Dr. Unwin, but some of the amazing experts and researchers that we work with around the world is really immortalizing them within the digital platform. Forever and ever. So realistically, that means for someone that's maybe Caucasian, they will see a video from Dr. Unwin telling them about the golden opportunities that has been presented to them as a result of being diagnosed with type 2 diabetes and subsequently referred into the low-carb program. It's not something that they need to completely despair about, and actually they have been given the hope and the support through the education that they can actually do something, and not only something, a lot, to actually put their type 2 diabetes into remission. And with these experts, we are then ongoing that engagement and that data-led approach, supporting their ongoing maintenance of these behavior change platforms and those behavior changes that we see within the platform. When it comes to the personalized education, it's kind of like a shout out to all of the doctors that we work with, that we love. So we have been absolutely privileged to work with Dr. Kesasadra, and he came, like Sam mentioned at yesterday's dinner, he came to the meeting that we had a couple of years ago, I think in Manchester, and presented the work that he's been doing for over, well, I don't want to say how old you are, but over 20 years in his practice, and he's working with a huge South Asian population, and I think what we've been able to do with him and with the platform is really apply the same principles of this low-carb approach and completely identify with the population of people that really need to, but also we're able to see from the data that we're engaging with that population in the right way. So a couple of years ago, when we were looking at some of the data for the South Asian population in particular within the platform, we found that it wasn't necessarily those individuals themselves that were living and experiencing type 2 diabetes or pre-diabetes that were engaging with the platform. It was perhaps their sons or daughters, grandchildren in some cases, that were engaging with the education in English, really localizing it and translating that into not only the native languages, but also making it culturally relevant for their parents and grandparents. And what we've been able to do with Dr. Kesa Sadra is deliver the only platform that has been fully localized for the South Asian community, not only in terms of the cultural norms, but also in terms of the languages and the phrasing that people are actually used to engaging with. We've then been doing a lot of work with behavior change mentors. So we know that when it comes to making significant changes to your diet and lifestyle, it really requires that solution-focused approach. And what we've done is really utilize the GRIN model that Jen has developed. We use a goal-focused methodology within the platform and really use behavior change mentors to support that change in behavior and also the sustaining of behavior changes. So we work with behavior change mentors, and some of them, I'm proud to say, are in the audience today. They come from backgrounds in science, in nutrition, in psychology, and what the role of the behavior change mentors is to not provide individualized information or advice to the patients that we see within the platform. That we know that is the role of the healthcare professionals. The role of the behavior change mentors is to understand maybe when someone falls off the wagon and just remind them that now that they've fallen off, that the wagon existed in that first place. Tell them and motivate them to identify what they're actually motivated to achieve in terms of identifying their health goals, and also signpost them to different elements and areas within the platform. Earlier this year, we also developed and launched a brand new recipe system, and that also has a meal plan generator implemented as well. And what this was to do was support the further personalization of that platform. And we now have the capacity to personalize the recipe suggestions or the meal plans that take into account perhaps if you've got allergies. It takes into account your dietary preferences. And we know, for example, by providing vegan or vegetarian recipes, that was really important to accommodate those with this real food approach. We take into account people's budget, and that, again, was one of the elements that we knew can sometimes inhibit people from progressing through the program. And then with the cultural norms, we've been looking primarily at the South Asian community, but we're expanding this out into other cultural norms within the UK and abroad. You can pick out the recipes that maybe take a short amount of time if you're strapped for time, but also, as we were hearing from some of the speakers earlier, just how important it is to make sure that we're educating and teaching people just how to cook as well as giving them the recipes. You can filter for the number of people that you're cooking for, and one of the things that we know from the platform is that some people are doing this to improve the health of their whole family. Perhaps there's just one person with type 2 diabetes or pre-diabetes in the family, but they're really looking to implement this as a solution for the whole population and the whole family. And finally, what we've done is we've seamlessly linked this into the food diary. So food data, food diary data in particular, has been notoriously difficult to research and analyze. And one of the things that we're really wanting to do within the platform is collect data on the dietary choices and the foods that people are actually eating, to then correlate that and see further improvements and enhancements within the platform. As I mentioned earlier, I've been lucky enough to be working with Dr. Laura Saslow at the University of Michigan. And with her, what we wanted to do is publish the outcomes of the low-carb program. We decided to randomly select 1,000 patients when they first signed up to the application. And what we were doing is following those for 3 years to understand not only is this a sustainable way of life and does the platform work to support the lifestyle changes, but then does it actually impact people's health outcomes? So of those 1,000 patients, what was most important for us as a digital technology and a digital solution is that 71% of patients were still actively engaged within the platform at that 1-year follow-up point. The one-year outcomes also go to demonstrate that on average, people that complete the program lose around 7.4 kilos, and they improve their HbA1c by 1.2%. We were then looking at the number of patients or people within the platform that were able to place their type 2 diabetes into remission. And we were doing lots of work understanding what remission meant to people, the phraseology that we used, and actually what happens when someone achieves remission, how we can then sustain that. But for the one-year outcomes, we've seen that 26% of patients were in complete type 2 diabetes remission. Their A1C was less than the type 2 diabetes diagnosis threshold, and they were off all medication, barring some cases metformin. We were then, as a secondary analysis, looking at the medication deprescription of those patients that were completing the application and completing the program. Those that started on the program, 40% of those were able to eliminate at least one diabetes medication if they started the platform on taking medication, and 60% of patients that were taking insulin were able to either completely eliminate it or significantly reduce that dosage from their prescription sheet. We've done a small economic analysis to understand just exactly what that means when it comes to the costs of medication, and obviously, especially when we consider the NHS and the growing burden of managing type 2 diabetes and pre-diabetes, especially if we're starting with a pharmacological approach. We're seeing that on average, through medication deprescription alone, people are reducing the amount of, we're seeing a reduction in £830 per person per year. So this also doesn't take into account anything beyond type 2 diabetes medication. And as Dr. Ullman's stats show, we're also seeing an impact on the likes of blood pressure lowering medication. We're seeing a wide impact on mental health elements and some of the medications associated with depression and anxiety as well. So really, this is my behaviour change platform, or my behaviour change wheel that I'm just in the final stages of publishing. And this is really what underpins the whole of the platform. And I really use this to demonstrate why we think it works. Although I'm going to be doing some sensitivity analysis to see if perhaps different people engage with different elements of this wheel. But essentially, from the moment someone steps into the platform, we're hyper-personalising it, and that starts with what their goal is. This is a self-selected goal. They tell us what they're motivated to achieve. Perhaps it's that they're looking to reduce their medication dependency, they're looking to lose weight, they're looking to improve the health of the whole family. And that gives us the opportunity to personalise the information and the education that they see from that point in. We then move on to the personalised education. So this is personalised to disease profile, to cultural norms, as we've discussed. So if we're talking about type 2 diabetes to someone with pre-diabetes, it doesn't have that same resonance. So we've actually personalised these streams within the platform for each of those different disease profiles. We then have looked at community support. So we know that by bringing people together and by sharing knowledge and exchanging in data, and I think there's many people here from the diabetes.co.uk forum that we've done a huge amount of learning on social interactions and community support. We've essentially replicated that same model within the platform and actually seeing how people are able to support each other in that behaviour change methodology. As a platform, we're device agnostic, so people that are tracking their steps on their wearable devices, or if they're lucky enough to have the likes of a Freestyle Libre or blood glucose meters, we're bringing that data into the platform to then be able to positively feed back the data insights that they're drawing from all of these different sources. We then have some behaviour change resources. So it's all well and good having the education and giving people the information that they need to go and make some changes. But actually what we're doing is facilitating that with specific, bespoke, personalised resources. So these may be meal plans, recipe suggestions, it may be food swaps or shopping lists, again, personalised to the requirements of those individuals. The behaviour change mentoring that I mentioned, this comes into this loop in a really significant way, not necessarily in an intrusive way for the users that are using the low-carb program, but as and when they require that behaviour change mentoring or a little bit of motivation or support, that's where they really come into their own. And this whole wheel is then underpinned by an AI-led data insights, drawing on understanding what's working for some people and quite often what's not working, and supporting that development of how we can increase that personalization for different populations. And I think ultimately this engagement process, this is what really means that people are sticking within the application, within the platform, and re-engaging with information at the time and those nudges that are really important and meaningful to those users. I don't think I need to just reiterate the impact of these outcomes that we're seeing within the low-carb program, but just to put it into perspective, a 1% reduction in HbA1c, and in the program we were seeing a 1.2%, it can reduce your risk of any adverse outcome by 21%, and obviously there's a huge cost saving associated with that as well. And I think this is really the information that we're sharing with the patients within the platform, empowering them with the knowledge that they're significantly reducing their risk and then ultimately improving their health.
And then when you compare it to standard care, it seems to look quite impressive. So as Charlotte mentioned, we were collecting our 1-year outcomes, or they were published, and we're currently pending publication of 2-year outcomes. Laura is definitely busy after the consensus report. So
she's taking a break.
She's taking a break, so we're being very patient. But the improvements, the health improvements that patients benefit from when they engage in the low-carb program are self-evident. In particular, my favorite statistic is that there's a 0.1% rate of type 2 diabetes remission, at least in evidence that I can find. And with the platform achieving 26% remission, it is probably the most rewarding part of our job. And so with this, we are scaling not only within NHS, but sort of further afield in primary and secondary care. When it comes to the NHS, it's been a very interesting journey. So when I was standing here 4 years ago, we were talking about 180,000 anecdotes. I'm pleased to say today we are talking about 410,000 participants collecting millions of data points in real time every single day. Our NHS innovation journey really started with our Chief Medical Officer, Dr. Campbell Murdoch, who put us in touch with Symphony Healthcare Services down in Wincanton, which is based in Somerset. The appetite there was extremely refreshing. They wanted to achieve 50 cases of type 2 diabetes remission within the space of a year. And we love a challenge. So we engaged with the local health community and really understood the local health economy. And we provided the platform to, I think it's just over 70 patients with type 2 diabetes. What was really interesting is this was actually part of a continuous improvement project. And really, as far as the objective was concerned, they really wanted to demonstrate, or really wanted to be able to see, whether digital health interventions could actually achieve type 2 remission, which they have seldom seen. So patients were given access to the platform through a referral code, and each week a health coach spent some time with participants, either in a one-to-one or group session, and they went through that week's lesson or that week's particular resource. Because they were seeing the health coach on a weekly basis, they then also inserted or inputted objective data. So they stood on a weighing scale and they entered their weight reading, or they took a blood glucose reading and they entered it into the platform. And over the course of 12 weeks and beyond, we were able to collect some quite significant statistics. I'm pleased to say that out of the 73 patients that were referred to the platform, there was a 97% engagement or uptake of the platform. And that's just unheard of. We see that 7.4% of people actually take structured education, and actually here we're talking about almost 100% uptake. What's even better is that 86% of patients were able to complete the full program. And for us, the full program means the full core 12 weeks of modules that participants receive. And I'm sure you'll agree that that is absolutely a stunning statistic. But what was even better was that all of the patients that were within that study lost weight, and the average weight loss was 8.7% of their body weight. We are currently collecting the A1C results and hope to publish them very soon. And as you can see, it is a very sort of, motivating reference site that we have managed to accrue. Our 1-year outcomes and our NHS NHS primary care pilot has really led us to what has been the pinnacle of our journey, which is acceptance within the NHS Digital Apps Library. I can tell you it was a very painful and arduous process that took way over 12 months and started really with a questionnaire of over 750 technical, clinical, and concerns that I just didn't quite understand. It took us a long time to complete that form, and I remember sitting with Dr. Unwin in Ireland, in Dublin, when we received our third round of medical objections, and I was pleased to say that in the last week of Christmas, I was given the best Christmas present of my life. The NHS app library then accepted the low-carb program. With that acceptance, we have been selected by the NIA Innovation Accelerator. And what was fascinating, or what was really motivating for us, is that the NHS would like to use the low-carb program to scale type 2 diabetes remission in primary care. That is music to my ears. Yeah. And I think it's fair to say that that applause is definitely directed at the NHS. The last 3 years has been an incredible journey. And I think for us, it was great to see the reputational backing of NHS Digital, of NHS England, but then also the wider support. So not only getting into the Innovation Accelerator, but then with the work that we're doing, working in at least a dozen research studies in order to generate novel data. We collect tons and tons of data from people not only with type 2 diabetes, but with epilepsy, with PCOS, with other conditions. And with our academic partners, it's really key that we publish the real-world evidence that we're generating, because just like with type 2 diabetes, the real-world evidence is pushing the academic guidance and protocols forward. The pinnacle of all of this was when Matt Hancock, Secretary of State, sorry, Tom Watson, retweeted the acceptance of our app into the NHS app library, and really the response from the media and wider healthcare community of the opportunities that scaling type 2 diabetes remission can provide. And then it's all well and good having a digital application, but how do you actually implement it? At the turn of the year, we signed a partnership with Essentia Diabetes Care, who will help us to accelerate the adoption of the low-carb program within primary care and NHS sites within England and Scotland.
We know as part of that we need a lot of healthcare professional training, and we've recruited some people that we feel are adequately prepared to deliver that. So the likes of Dr. Campbell Murdoch, our Chief Medical Officer, here in his practice on his bike at lunchtime in between seeing patients. So he has both the experienced-led knowledge and the insights of the approach to be able to empower healthcare professionals to support their patients and achieve that goal of scalable type 2 diabetes remission. And this is just one of the things that we're doing with the great team at Essentia.
So not only do we have off-site or on-site, rather, physical training for healthcare professionals on how to adopt the approach, how to implement the approach within their practice or wider healthcare economy, we also then provide that digitally as well, so it's accessible anywhere at any time. For patients, the experience is actually really easy. So we would work with the local team, either within the practice or CCG, in order to develop a bespoke communications and implementation plan. And essentially what that means is we dig into the data and we understand the patients. What are they interested in? What do they eat? What do they not eat? And are there any particular habits or insights that are interesting for us to work with? Once we understand those, we then create bespoke communication plans, essentially notifications such as SMS notifications, emails, maybe even postal letters, might be leaflets or posters for you to have in your surgery in order to engage and refer that participant into the platform. Once they download the app or they visit the low-carb program, they type in a code. That code is linked to the NHS practice or the CCG, so we can collect data in real time. And then the participant then engages within the platform. And what we know is that of every 2 participants that joins the platform, at least just over 1 of them will actually reduce their medication dependency by the end of 1 year. Which is all well and great, but then how does the clinician, how does the primary care team actually get to see this data? So obviously we can have the patient go into practice for demedication reviews, which we strongly encourage and is part of the implementation plan. But on top of this, we give access to real-time data or near real-time data, either in a web dashboard or perhaps PDF reports, in order for you to see how your population is progressing within the low-carb program. And what we have found with our partnerships is that this is a really motivating tool for clinicians, because they can genuinely see the impact that the program or the behavior change is having on their patients without actually having to call the patient back in. And what really started 4 years ago when we launched the low-carb program was a journey into real-world evidence collection in a number of conditions. And it's fair to say that our future projects and the projects that we have in the pipeline all fit somewhere on that diagram. What we can see improvements in terms of health conditions, we see improvements in terms of mental health, prediabetes, obesity, type 2 diabetes, moving into areas of other non-communicable diseases. The impact of the low-carb approach, of the low-carb program, if scaled within the NHS, has a huge and significant opportunity to absolutely transform diabetes management, and that's before the type 1 program. We just wanted to end with a video that we shot with a group of people who came to an event that we held in Birmingham. And I think this, well, says everything that we would like to say in about 30 seconds.
I was diagnosed with type 2 diabetes.
Type 2 diabetes.
Type 2.
Type 2 diabetes.
I think like a lot of people, I was in a bit of shock, devastated.
That was the end of life as I knew it.
I joined the low-carb program,
Low carb program. Low carb program.
I became much more energetic.
feeling healthy and fit.
Amazed.
I feel fantastic.
Fitter and healthier, happier. So I'm happy.
I speak on behalf of Charlotte and myself when I say that our ambition and best hope is to scale the low-carb program so that every patient in England and under the care of the NHS has the opportunity to share a story just like that. Thank you.